Doctor, I know you're over at the 3D model right now. A big problem that comes with high cholesterol is a condition called atherosclerosis. What exactly is that? And show us with the diagram here exactly what's happening.
Well, certainly. And as we described, atherosclerosis is really what we're concerned about. We try to identify who is at risk for atherosclerosis, prevent it, or control it. So that's why we look at things like the cardiac risk factors, elevated cholesterol, elevated blood pressure, diabetes, smoking, because those things will increase the risk of atherosclerosis. But atherosclerosis is the actual disease. So here's a schematic. It's kind of basic, a little kind of cartoon of atherosclerotic plaque, which we'll talk to you about. So these, for the first place, are red blood cells and white blood cells. So this is just for the schematic. But here's an artery wall. Blood travels through the arteries into your organs. It's a part of our major components of life. The wall has different layers. The inner layer is what's exposed to the bloodstream. And in the inner layer, when you have these particles filled with cholesterol, filled with triglycerides, something could inflame the wall, and these particles actually enter into the wall of the artery. So atherosclerosis occurs in the walls. In the early stages, it may not narrow the arteries. Later on, it could actually start narrowing your artery so you have lower blood flow. That's a person who may have angina. I walk, I get chest discomfort, it hurts, I rest. Why? Because the atherosclerosis, this inflammation caused by these cholesterol-containing particles, narrows the artery. But what we really are concerned about, this is what we talk about in prevention, is this, which of course is a very schematic drawing, but when this plaque builds, it's soft and mushy. We think of it almost like a pimple that bursts, and this wall can rip. And when this wall rips, then you get a blood clot. And that is a heart attack or a stroke. So this is why it's an evolution from plaquing, which people won't know about. In this stage, it's asymptomatic. People have no idea they have cholesterol-containing particles leading to atherosclerosis, and only later, when the artery narrows and you get symptoms, or rips and you get a heart attack, it can be problematic. And the rip can sometimes happen suddenly, hence, we want to evaluate people, educate people, look at their risk, treat them to prevent this process. But the most important component is the plaque that's generated by these cholesterol-containing particles are in the walls of the arteries leading to this process. That's atherosclerosis.